Wounds Canada is pleased to provide a new informational series called Care at Home. This session will provide the user with information about the series and instructions for effective use of the documents. In this brief tutorial, we will identify what the Care at Home series is all about and discuss the rationale that led to the development of this series. Every Canadian has the ability to benefit from this series, whether it be for personal care, professional care, or for health care delivery. It will also review the key components that are the core of each of the Care at Home documents, as well as a brief review of each of the 10 documents currently in the series. Additionally, we will explore how to use the Care at Home series to increase and validate health-positive behaviors, to maintain healthy skin, and for wound prevention and management. Wounds Canada always planned to develop a Care at Home series. Then COVID-19 happened, and it became a top priority. During the COVID-19 pandemic, many persons were and continue to be unable to access the care they need for their wounds and information on how to prevent them from happening in the first place. The Care at Home series provides resources for anyone who wants to identify and implement health-positive behaviors to help better prevent and care for wounds while in an at-home setting. But let's back up a little bit and look at the rationale for this important series. Health Canada states health behaviors are influenced by the social, cultural, and physical environments in which we live and work, and shaped by individual choices and external constraints. We know positive behaviors help promote health and prevent disease, while the opposite is true for risky behaviors. This Care at Home series helps you make health-positive decisions. So to support the health-positive behaviors, whether there's a risk for skin damage or actual skin damage, Wound Canada currently has 10 Care at Home documents. 12,000 documents have been downloaded since the first one appeared in mid-April. These documents were developed by experts in skin and wound care, education, and knowledge mobilization. They provide a resource for anyone who wants to identify, support, and implement health-positive behaviors to better maintain healthy skin and care for wounds while in a home setting. How do they do it? Well, each Care at Home document follows the same step-by-step process. They look at what is it. So they identify and describe the potential or actual skin health problem. What causes it? They review the risks that may lead to this problem. What does it look like? They explore the typical characteristics of the problem. How do you prevent it? They discuss actions that may be taken to prevent skin breakdown. What to do if you have one. They discuss actions to take if you have one. And when to call a professional. What do you look for? What should you be concerned about? And when do you call in help? The Care at Home documents also include resources such as images, tips, tools, and tables. Let's take a brief look at each of the documents. Caring for your wound at home, changing a dressing. This particular document walks you through a simple step-by-step process for changing a dressing and checking on how the wound is doing. You'll be able to identify factors that may tell you the wound is getting worse or the wound is getting better, which will lead you to calling in a healthcare professional when required. The second one is preventing and managing skin injuries, such as minor trauma, scrapes, cuts, bruises. It provides information on how to keep the skin healthy by preventing minor injuries, especially important for individuals who are at high risk. For example, someone who is immunocompromised, or if you have very fragile skin. Caring for swollen legs at home, preventing and managing venous leg ulcers, otherwise known as VLU. This document outlines possible causes of leg swelling, particularly related to venous leg edema. It provides information on what you can do at home to prevent or manage swelling related to venous disease, as I mentioned, should it occur. Also, another paper is Caring for Easily Injured Skin, Preventing and Managing Moisture-Associated Skin Damage, or MASD. This reviews the possible causes of MASD, such as incontinence-associated dermatitis, intertrigo, trench foot. It provides information on what you can do at home to prevent or manage MASD should it occur. Another document is Caring for Pressure Injuries at Home, Preventing and Managing Pressure Injuries, or PI. This document outlines actions you can safely take to prevent a pressure-related injury from occurring or to care for an existing pressure injury. Another document is Caring for Yourself After Surgery, Preventing Surgical Site Infections. This document provides guidance on actions that individuals and their care partners can do before and after surgery to help prevent infections and recognize the signs of infections if they do occur. Caring for Your Feet, Safe Foot Care If You Have Diabetes, provides a simple guide for persons that have diabetes and their care partners on how to care for their feet at home. The second one is Diabetic Foot Complications. When is it an emergency? Again, it provides a simple guide for persons that have diabetes and their care partners to help prevent or care for diabetic foot complications in the home setting. The last two documents that we have currently online are Caring for Injured Skin, Preventing and Managing Burns. This document provides a simple guide to help prevent and manage burns, particularly minor burns, that occur in the home and in the home environment. And lastly, Keeping Your Home Safe, Preventing Skin Injuries for the Whole Family. This document identifies many simple, inexpensive updates that you can make to ensure comfort and safety in and around your home and in the home environment. Now that you know what they are, how do you use these new resources provided by Wounds Canada effectively? Well, you have reached the first step by knowing that they are here, free, and downloadable. If you are a person concerned with your own health-positive behaviors, a caregiver, a healthcare professional, or a healthcare administrator, these documents are for you. If you're using these documents for personal use, you need to download the document, Care at Home, that applies to you. You need to read the document all the way through. Contact your healthcare provider to clarify any action or anything, any term you are unsure about, and then make health-positive choices to prevent or treat skin breakdown. If you are using the Care at Home series for professional use, you can download and review the Care at Home documents, all of them. Select the most appropriate documents for your individual patient or caregiver instructions. Take the time to review and discuss the documents with your patients and caregivers to make sure they have a good understanding of the content, and then provide additional instruction and guidance as required. If you are an administrator or policymaker, you need to download and review, again, all the Care at Home documents. You need to recognize the value of preventative care and self-management in reducing pain, suffering, and healthcare costs. And then finally, ensure that decision-making and policy statements connect to prevention and self-management. Let's tie all this information together with a case study. Sandra is a 69-year-old retired woman who has had diabetes for approximately 12 years. She's had an active diabetic foot ulcer for at least a month, but she's not sure really what caused it. However, it's not causing her any pain, just bleeding in her socks and shoes, which is annoying her. She's been covering the wound with a dry gauze and wears a loafer slip-on shoe when she's out and about and just socks when she's at home. She says her blood glucose levels have been fine and she's otherwise healthy. The first step is to determine what Sandra knows and what she needs to know about her diabetic foot ulcer. This will help you determine which care-at-home documents would be most beneficial for her. The care-at-home document diabetic foot complications, when is it emergency, and caring for your wound at home, changing your dressing, are both very meaningful to Sandra's case. Sandra needs to know how to treat the wound, including how to do dressing changes. She needs to know how to inspect the wound to determine if it's getting better or getting worse. And finally, she needs to know the importance of pressure relief to her foot at all times. All of these will support healing. In the first step, we learned what Sandra needed to know. Now in the second step, we need to know what Sandra needs to do now. So the actions would be Sandra is changing her dressing, inspecting her wound, and removing pressure from her foot by safely using her offloading device during the day and crutches to get to the bathroom at night. She knows she needs to put no pressure on that healing wound. Importantly, if Sandra does not know how to do something or unsure about the meaning of something, she needs to contact her healthcare provider. Finally, the third step. 2 months later, Sandra is celebrating that her ulcer is now closed, and she wants to make sure it doesn't come back and she doesn't develop any new ones. What should she do now? Which care-at-home documents will make health-positive choices easier for her? Well, caring for your feet, safe foot care if you have diabetes is definitely important, as well as preventing and managing skin injuries such as minor trauma. So long-term plan for Sandra, she is now aware that she needs to take better care of her feet every day by making healthy choices around foot care, footwear, and foot safety. So what exactly are the benefits of the Care-at-Home series? Well, they connect individuals with the most recent information to prevent or manage skin breakdown on specific topics. They provide a common language to connect healthcare providers and patients and their families and caregivers together. They provide tracking tools for progress or deterioration of wounds or skin problems. They provide information on when to call in professional help. So in summary, you are now familiar with the Care-at-Home series, its components, the rationale that led to its development, and how to effectively use them. So your next steps are to make a plan to use the Care-at-Home series to increase health-positive behaviors for skin health, wound prevention, and management. And remember, as Groucho Marx says, an ounce of prevention is worth a pound of bandages and adhesive tape. Thank you. You can go to the Care-at-Home resources on the Wounds Canada webpage. Select Patients and Caregivers tab, click on the Care-at-Home series link, and you're there. Wounds Canada would like to acknowledge the Canadian Red Cross emergency support to community organizations programs through the Canadian Red Cross and the Government of Canada to support the Care-at-Home series.